Varus and Valugs testing of the toes is looking for an MCL sprain or LCL sprain. A positive test is pain or increased laxity or decreased laxity when compared with the same joint on the opposite extremity. Intermetatarsal glides are looking for trauma to the deep transverse metatarsal ligament, interosseous ligament, or both. Pain without the presence of laxity may indicate the presence of a neuroma. The positive test is pain or increased glide or decreased glide compared with the opposite. Midtarsal joint play is looking for ligamentous laxity, joint adhesions, articular changes causing coalition of the joint, and positive testing is pain associated with movement or increased or decreased glide relative to the opposite foot. The dorsiflexion eversion test for tarsal tunnel syndrome is looking for posterior tibial nerve dysfunction. A positive test would be provocation of pain and or paresthesia radiating into the foot.
The anterior drawer test is to check for the integrity of the anterior talofibular ligament. The positive test is when the talus slides anteriorly from under the ankle mortise compared with the opposite side. The Talar Tilt test is to test for the integrity of the calcaneofibular ligament and the deltoid ligament. A positive test is if there is excessive gapping. Klager's test is done to determine if there is any rotary damage to the deltoid ligament or the distal tibiofibular syndesmosis. A positive sign is medial joint pain or if any displacement is felt as the talus moves away from the medial malleolus. Subtalar joint play is used to assess the motion of the subtalar joint. A positive test is any increased or decreased medial or lateral translation of the talus relative to the opposite side. Cotton test is used to assess the amount of lateral translation of the talus within the ankle mortise. A positive test is any increased lateral translation. Distal tibiofibular joint play is used to assess the amount of anterior or posterior play in the distal tibiofibular syndesmosis. A positive test is pain arising from the syndesmosis or increased motion relative to the uninvolved side. The squeeze test is used to identify a fibular fracture or a syndesmosis sprain. A positive test is if pain is elicited, especially when it is away from the compression area. Thompson Test is used to help identify an Achilles tendon rupture. A positive test is when the calf is squeezed and the foot does not plantar flex. The bum test is used to identify a stress fracture of the talus or the leg. A positive test is when pain is emitted from the fracture of the calcaneus, talus, fibula, or tibia. Forced dorsiflexion is used to help identify a syndesmosis sprain. This is because the talus is shoved into the ankle mortise. A positive sign is when there is pain while being forced into dorsiflexion.